Welcome. Today we're diving into a rare and often misunderstood condition, hemangioma of the heart. While hemangiomas are relatively common in other parts of the body, their presence in the heart is quite unusual. Join us as we explore the causes, symptoms, diagnosis, and management of this fascinating cardiac anomaly. The exact cause of cardiac hemangiomas remains largely unknown, making it a challenging area for researchers. Most are believed to arise sporadically, meaning they don't seem to be inherited or directly linked to specific environmental factors. Some theories suggest they may be congenital, developing during fetal development. Others propose they could be related to abnormal blood vessel formation or growth signals within the heart tissue itself. Further research is needed to fully unravel the mysteries surrounding their origin. Cardiac hemangiomas are benign tumors composed of blood vessels that form an abnormal mass within the heart. Their effect on the heart depends significantly on their size and location. Small hemangiomas may be asymptomatic and cause no functional impairment. However, larger hemangiomas can compress heart chambers, disrupt electrical conduction pathways, or obstruct blood flow. This can lead to a range of complications, including arrhythmias, heart failure, pericardial effusion, and even sudden cardiac death in rare cases. The hemangioma essentially disrupts the heart's normal architecture and function, leading to these potential problems. Cardiac hemangiomas are extremely rare. Precise epidemiological data is difficult to obtain due to their often asymptomatic nature and the challenges in diagnosis. They are estimated to account for only a tiny fraction of all primary heart tumors. While they can occur at any age, they are more commonly diagnosed in younger individuals, including infants and children. There doesn't appear to be a significant difference in prevalence between men and women. Many individuals with cardiac hemangiomas experience no symptoms at all, particularly if the tumor is small. When symptoms do occur, they can vary widely depending on the size, location, and impact of the hemangioma. Common symptoms may include chest pain, shortness of breath, palpitations, fatigue, dizziness, and swelling in the legs or ankles. In more severe cases, patients may experience fainting spells or even sudden cardiac arrest. Because these symptoms can mimic other heart conditions, diagnosis can be challenging. Diagnosing a cardiac hemangioma requires a combination of imaging and clinical evaluation. An echocardiogram is often the first step, providing a non-invasive way to visualize the heart and identify potential abnormalities. More detailed imaging techniques, such as cardiac MRI or CT scans, are typically used to confirm the diagnosis, assess the size and location of the hemangioma, and evaluate its impact on surrounding structures. In some cases, a cardiac catheterization or biopsy may be necessary to obtain a tissue sample for definitive diagnosis. Cardiac hemangiomas can be classified based on their histological type and location within the heart. Histologically, they are generally categorized as capillary, cavernous, or arteriovenous hemangiomas, based on the type and arrangement of blood vessels within the tumor. Location-wise, they can occur in any part of the heart, including the atria, ventricles, valves, and pericardium. Their classification helps guide treatment decisions and predict potential complications. Additionally, some cardiac hemangiomas may be associated with syndromes like Cassabach-Merritt phenomenon, characterized by thrombocytopenia and consumptive coagulopathy. Treatment for cardiac hemangiomas depends on the size, location, and symptoms they cause. Asymptomatic, small hemangiomas may be managed with observation and regular monitoring. Symptomatic hemangiomas often require intervention. Surgical resection is the preferred treatment option when the hemangioma is accessible and can be removed safely without damaging vital heart structures. In cases where surgery is not feasible, other options include radiation therapy or embolization, which aims to block blood flow to the tumor. Medications may be used to manage symptoms such as arrhythmias or heart failure. Currently, there are no known preventative measures for cardiac hemangiomas, given that the underlying causes are poorly understood. Because the cause is largely unknown, there are no preventative measures. The prognosis for patients with cardiac hemangiomas varies depending on several factors, including the size, location, and symptoms of the tumor, as well as the success of treatment. Small asymptomatic hemangiomas may not require any intervention and have an excellent prognosis. Larger, symptomatic hemangiomas that can be completely resected surgically also generally have a good outcome. However, hemangiomas that are difficult to access or remove completely, or that cause significant complications, may have a less favorable prognosis. Ongoing research is focused on identifying the genetic and molecular mechanisms involved in the development of cardiac hemangiomas, with the goal of developing more targeted and effective therapies. Scientists are also exploring novel imaging techniques to improve early detection and diagnosis. Advances in minimally invasive surgical techniques offer promise for safer and more effective removal of these tumors.